Chest tube insertion, also called tube thoracostomy, is a common emergency procedure used to drain air, blood, or fluid from the pleural cavity. It is often performed in cases of trauma, pneumothorax, hemothorax, or after failed needle decompression. The procedure can be demonstrated on a mannequin for training. First, make an incision at the selected site, then insert the curved forceps and open them to widen the entry point for the tube. If safe, perform a finger sweep while wearing double gloves to protect yourself. Using the curved forceps, guide the tube into the chest. In most patients, aim posteriorly first, then rotate the tube upward, apically, advancing about 10 centimeters or more in larger patients. If unsure about the chest depth, a quick ultrasound or information from an EFAS scan can provide guidance. Clamp the tube's end to prevent blood spillage, and be careful that it doesn't slip out. Once in place, secure it using strong suture material, ideally silk. Place a large suture above or below the tube and tie it off, leaving the ends long. To avoid accidental needle sticks, you may cut off the needle at this stage. Then, tie several firm knots around the tube close to the skin. Alternate the direction of each knot and keep them grouped together. Avoid elaborate methods such as the Roman sandal technique, since these loosen easily and do not provide proper fixation. This procedure is usually performed via a costal margin approach, often in traumatic cardiac arrest on the injured side, or when needle decompression has failed in tension pneumothorax.